Welcome all to our today's presentation, and for our today's health talk, we want to have a look at the various causes of abdominal distension. But before that, let's take note of the following. One, that abdominal distension is a case where the abdomen appears to be bigger than the normal. Now take note that abdominal distension may not necessarily arise from the gastrointestinal system. It may also occur as a result of other systems not related to gastrointestinal tract. Now, the list that I want to present to you is not a conclusive list, but rather highlights the most common causes of abdominal distension. So let's get into it very quickly. Now, the first cause of abdominal distension is called pregnancy. As you all know, that as gestation progresses, the size of the abdomen increases. So, in summary, or in simple language, the size of abdominal distension in pregnancy increases with gestation. The second cause of abdominal distension is called menstruation. And it has been identified that in some ladies, they do experience abdominal distension, especially when they are experiencing their menstruation. And this does not apply to all women or all ladies. The third cause of abdominal distension is called obesity, and this is self-evident. The next cause of abdominal distension is called intestinal obstruction. And intestinal obstruction is a very common condition, or a very common surgical condition that quite a number of patients have developed or do develop. The next cause of abdominal distension is called gastroparesis, and this simply refers to partial paralysis of the stomach. The next cause of abdominal distension is celiac disease, and this is also a very common gastrointestinal tract disease. The next cause of abdominal distension is referred to as exocrine or exocrine pancreatic insufficiency, and this has also been identified as one of the common causes of abdominal distension. The next cause of abdominal distension is inflammatory bowel disease, sometimes referred to as the IBS. The next cause of abdominal distension is peritonitis, and peritonitis is an inflammation of the peritoneum lining of the abdomen. The next cause of abdominal distension is ascites, and the ascites is simply referred to as fluid within the abdominal cavity or within the abdomen. The next cause of abdominal distension is abdominal tumors, or sometimes the abdominal growths. The next cause of abdominal distension is intra-abdominal hemorrhage or intra-abdominal bleedings. And this can be as a result of either blunt trauma or blunt injuries, or what we refer to as the gastrointestinal bleeding or GIT bleeding. The next cause of abdominal distension is constipation, and constipation is the hardening of stool. Now, other causes of abdominal distension is urine retention or urinary retention, which is also very common, especially with the patients who are suffering prostate issues or prostate conditions, are seen in benign prostate enlargement. The next cause of abdominal distension is indigestion, which is medically referred to as dyspepsia. This is evidenced or seen in patients with ulcers or hypercidity. The next cause of abdominal distension is referred to as the diverticulitis. And diverticulitis is a process of diverticulum formation, and diverticulum simply means pockets within the intestinal linings. The next cause of abdominal distension is the kidney stones, simply referred to as medically as renal calculi or sometimes nephrolithiasis. The next cause of abdominal distension is certain parasitic infestations as seen in hookworm or even giardiasis caused by the Giardia lamblia. The next cause of abdominal distension is seen in what we refer to as malnutrition, as seen in kwashiorkor. So patients suffering kwashiorkor or even children suffering kwashiorkor do develop abdominal distension. The next cause of abdominal distension is referred to as anterior pelvic tilt, and this leads to protrusion of the abdomen. And this is also a very common condition. The next cause of abdominal distension is premenopausal or premenstrual syndrome. So it can occur as a symptom of premenstrual state, or it can occur intramenstrual state. Now, ladies and gentlemen, abdominal distension is a very common condition, and therefore it may point out to a very serious underlying condition. And therefore it is very, very important that should you as an individual suffer abdominal distension, or should you come across any individual or clan suffering abdominal distension, then kindly please refer yourself or that particular individual to the nearby health facility for quick medical intervention in terms of thorough examination and extensive medical investigations. If you're watching us for the very first time, kindly subscribe. And until next time, it's goodbye from all of us.